Okay. So, good morning, everyone. Hello. Hello. I will start again. So, good morning, everyone. I am Dr. Ravi Meher. I am working as Director Professor and Head at Maulana Azad Medical College. And at the outset, I would like to thank the organizers and especially Dr. Deepak Haldipur for inviting me and allowing me for this talk. So, the topic which was allotted to me is taste disorders, addressing them comprehensively. Right? So the disclaimer, this presentation actually uses some of the pictures from the Google, and wherever possible, I have tried to reference them. And lastly, there's no financial involvement or interest in the presentation. Outline of the presentation. So I will be talking about taste disorders, so anatomy and physiology of the taste sensation, then the how to clinically evaluate the taste sensation, then we'll discuss about the causes of taste disorders, diagnosis and management. So, what is taste? Taste is a very complex interplay of the gustatory, olfactory, somatosensory, and emotional stimuli. And taste disorders are actually very rare. I mean, isolated taste disorders are rare disorders and they are difficult to diagnose. And whenever there is a loss of taste, eating or drinking may become bothersome for the patient. There can be nutritional problems because the patient is not able to take good nutritional things, and there can be impairment of the quality of life. So taste is also called as gustation, and there are basically two main chemosensory organs, which are the nose and the oral cavity. Nose is actually for the smell, and the oral cavity is actually for this taste. And both these organs, the nose and the oral cavity, are actually innervated by the trigeminal nerve fibers. And this provides the general somatic sensation for the nose and the oral cavity. And it is responsible for the texture, the temperature of the food, as well as the irritation and the concentration of the food which we are eating. Simultaneously, stimulation of all the three modalities can occur when we are actually having food. So the food, when is taken inside the oral cavity, we have the flavors also, we have the smell also, and we can actually taste the food also. So both these things actually occur simultaneously. There is one more route of olfaction, and basically that is a retronasal route. So whenever we eat food, some of the food can actually get converted into vapor form, and these vapors or the smell particles can actually go to the nasal cavity via retronasal route, that is through the nasopharynx, right? And the patient can smell. So the flavors, for example, in a cinnamon candy, when we eat cinnamon candy, the cinnamon gets converted to the vapor form in the oral cavity, and then it is transported to the olfactory area through the nasopharyngeal route, right? So also taste actually stimulates the secretion of saliva and the gastric juices. So it actually prepares the oral cavity and the oropharynx for the take of the food. What are the taste organs? So taste organs are actually present in the taste buds, and they are actually in the papilla. So there are various papillas which are found in the oral cavity. These papillas are called as circumvallate papillae, foliate, fungiform, and filiform. Circumvallate papillae are the largest papillae, and they are present actually in the front of sulcus terminalis, right, at the juncture of the anterior two-thirds of the tongue and the posterior one-third of the tongue, and they have taste buds. Similarly, foliate papillae, these are present on the margins and the near the sulcus terminalis, and they also have taste buds. Fungiform papillae, these are present on the margin and tip, and they also have taste buds. The filiform papillae, these are the numerous conical shaped papillae which are present all over the dorsal surface of the tongue, and they are arranged parallel to the sulcus terminalis, but they do not contain any taste buds. So, what is a taste bud? Taste bud is basically a structure which is present on the tongue and the other part of the oral cavity. They are barrel shaped. They have a small taste pore through which the chemical substance for the tasting actually enters the taste bud, and there are around 10,000 taste buds over the oral cavity. What are the site? The majority of them are actually on the tongue, but there are numerous taste buds present on the palate, pharynx, epiglottis, and upper one third of the esophagus. Anatomy of the taste buds. So, how these taste buds are formed? These taste buds are actually formed by the gustatory receptor cell, and these are actually replaceable every 10 days. Gustatory hair projects through the taste pore. So, these receptor cells have hairs which actually project into the taste pore. There are supporting hair cells also. These supporting cells are basically type 3 cells, and they are type 1 and type 2 cells which are called as basal cell. The basal cell actually give rise to the gustatory receptor cell, right? So they actually form the gustatory receptor cell during replacement process, right? At the base of the receptor cell, there is a synapse, right? Synaptic connection is there with the dendrites of the first order neurons, which carry the taste sensation to the central nervous system, right? So each receptor cell is innervated by a first order neurons. What is the nerve supply? So anterior two-thirds of the tongue is supplied by the chorda tympani nerve, which is a branch of facial nerve, and the posterior one-third of the taste sensation is carried by the glossopharyngeal nerve. General sensation, the general somatic sensation in the anterior two-thirds of tongue is taken by the trigeminal nerve, the lingual nerve, and the posterior one-third is taken by the glossopharyngeal nerve. So what is the taste pathway, right? So the taste is actually carried from the tongue through these three nerves, the glossopharyngeal nerve, the vagus, and the facial nerve, the chorda tympani branch of the facial nerve. And these are the first order neuron, and they relay in the nucleus tractus solitarius, which is in the pons, right? And in the midbrain, there is a crossover of the fibers. So the contralateral and the ipsilateral fiber, they cross over, and the second order neuron, they arise from the nucleus tractus solitarius and they relay to the thalamus, right? And there is the ventro-posterior medial nuclei. From the thalamus, the human taste pathway actually goes to the primary gustatory cortex and the secondary gustatory cortex, which are there in the cerebral area. The cerebral area responsible for primary gustatory cortex is the insula, frontal or parietal operculum, and the orbitofrontal cortex actually is responsible for the secondary gustatory cortex. So this is a currently accepted human taste pathway. We come to the physiology of taste. So there are 5 primary taste sensations. These are sweet, salt, sour, bitter, and umami. Right? Umami is basically the glutamate in the Asian cooking, and it has got a pleasant taste. Now, water is also perceived by the tongue differently, right? And it is supposed to be the 6th basic sense, taste sense. What is the mechanism of stimulation? So, whenever there is a chemical uh, uh, molecule is presented to the taste bud, it actually binds to the receptor molecule and then it opens the ion channel and it allows the positively charged sodium ions and the hydrogen ions to go inside the cell, leading to depolarization. So once the depolarization is there, there is an action potential generation in the dendrites or the first order neuron, and the stimulus is passed to the higher center, right? And as soon as the taste is washed up, the stimulus is removed. What are the factors influencing the taste disorder? So taste disorder is the basically taste threshold is the minimum concentration at which the substance can be perceived. So if you have the area of stimulation increased, the threshold will decrease, right? And also the maximum sensitivity of the taste buds is actually at the 30 to 40 degree, which is the body temperature. Olfaction, presence of olfaction will affect the flavor and enhances the taste of the food. With age, the atrophy of taste buds occur and there can be decrease in taste sensation. Generally, women have more sensitive taste to sweet and salt. And also adaptation. So adaptation can occur, which can lead to increase in the taste threshold. For example, when we have a sweet, very high sweet thing, after that, if we take suppose tea or coffee, we don't feel the taste. So that is because of the adaptation. Okay, so this is another interesting thing which I found on the net, and it is basically miraculin. So miraculin is a protein modifier which is present in this miracle fruit. So these are the red berries which are found in West Africa, and they can actually modify the taste. So they can change the taste of sour substance to the sweet. Right? So this was a very interesting finding which I found in the internet. What is the role of saliva? Saliva is very, very important because it acts as a solvent for the taste chemicals. So whatever taste we have, like salt or sugar or bitterness, so these all these taste chemicals have to be dissolved in saliva for the taste buds to actually perceive the taste, right? And xerostomia or decrease in saliva can actually cause problem, can cause decrease in taste sensation. It can lead to damage of the nerves and can lead to altered taste sensation. For example, in patient with head and neck radiation therapy, post radiation therapy or Sjogren's syndrome, there is a lack of saliva and patient has decreased sense of taste. Now we come to the taste disorders. So basically, taste disorders are very challenging to manage, and this is because of the fact that the there is no proper technique available for measuring the taste function. It is often very difficult to diagnose and offer a treatment option to the patient. And it is also very important to differentiate whether it is actually taste disorder or it is a smell disorder, because these are both interconnected. Patient with smell disorder can have altered taste sensation, and similarly if there is a taste disorder, patient can have altered nasal olfaction. So these are the terms which are used for describing various taste disorders. So ageusia means loss of taste sensation. Hypogeusia means partial loss of taste sensation. Hypergeusia means enhanced taste sensation. Dysgeusia or parageusia means altered taste sensation. Cacogeusia means unpleasant or revolting taste. Heterogeusia is inability to distinguish between various tastes. Phantogeusia is gustatory hallucination. There is no taste. The patient has not taken anything orally, but he has some hallucination. So that is gustatory hallucination or phantogeusia. And there is a last term which is often used is taste blindness. It is basically inability to detect certain taste. For example, phenylcarbamide. So the taste disorders can be actually, classified as quantitative disorder or qualitative disorder. The quantitative disorders can be hypogeusia or loss of taste sensation, that is ageusia. So it is a measurable disorder. These are rare because these are isolated taste disorders are very, very rare and they are not really recognized. Qualitative disorder meaning there is an altered taste sensation. There is a taste sensation present, but there is a distorted taste sensation like parageusia or phantageusia. And these are non-measurable. They are more frequently seen and they are always recognizable. What are the different causes of taste disorder? So one of the important causes is a direct nerve injuries. Like for example, when we operate a patient with ear surgery, like stapes surgery, and we have damaged the chorda tympani, a patient can have taste disturbance or loss of taste over one half of this tongue, right? Similarly, dental surgeries, oral surgeries, and tonsillectomies can lead to taste disorders because of the direct injury to nerves. Facial paralysis, fracture of the temporal bone can also lead to loss of taste sensation. Then there can be stroke like brainstem, hypothalamus, pons, or frontal lobe involvement can lead to taste disorders. Head trauma, neurological disorders like multiple sclerosis, lateral sclerosis, and tumors can also cause taste disorders. Then there are drugs and uh, chemotherapeutic agents which can lead to taste disorders because of the side effects, right? And for example, terbinafine, antibiotics, antihypertensive drugs, antifungal drugs, all these can cause altered taste sensation. Deficiencies of zinc, vitamin B, B12, 1, 2, and 6, iron, copper, malnutrition, cachexia can also lead to taste disorders. Systemic disorders like cancers, renal and hepatic insufficiencies, diabetic, Sjogren's syndrome, and sarcoidosis can lead to taste disorder. And very commonly, which is seen like is the post-viral infections, upper respiratory tract infection, which we very commonly see after COVID-19. Right, we had seen lots of patients having taste disorders or having altered olfaction after COVID infection. And lastly, there can be idiopathic or psychological causes where we don't know the cause, what is the cause, but patient has altered taste sensation. So there are different drugs like ACE inhibitors, diuretics like spironolactone, furosemide, lipid-lowering agents, statins, anti-proliferative drugs like cisplatin. These are the drugs which can cause taste disturbances. Uh, Rarer causes like pine nuts. Pine nuts can actually cause altered taste sensation, and it can last for weeks or even months. And there can be paraneoplastic symptoms which can lead to taste disorders. Sweet dyschezia can actually happen in patients with lung cancer or thymus cancer. So how do we diagnose? So diagnosis is difficult because of the taste disorders. Diagnosis is difficult because of the lack of standardized taste test available, right? Detailed history and examination is important. Surgical procedures of the head and neck, upper digestive tract pathologies, medications, post-infection. So we need to actually do a detailed history and examination, rule out the causes for various taste disturbances, and then investigate also the patient to rule out various etiology. Imaging and like CT, MRI can be required in cases we are suspecting neurological causes. So we come to taste testing. So there are no clinical objective tests available for taste testing. Majority of tests are subjective, and there are pathologies like dementia, neurodegenerative disorders, where these tests will be unreliable because patient is not very cooperative for these subjective tests. There is a lack of standardization, and there is no universally accepted method for taste testing. So what are the taste testing methods available right now? We have chemical testing. So chemical testing is basically semi-quantitative test, and we can actually use various concentration of solutions to check for taste sensation. And this is one test is called as 3-drop test, when we aqueous solution of 5 basic tastes are actually used, which are dropped on the tongue of the patient, and then you ask the patient whether he is able to correctly identify the taste or not, right? And you can actually decrease or increase the concentration of the aqueous solution and determine the detection threshold also, right? And there can be recognition threshold where subject is able to correctly identify the taste, and detection threshold is basically when the lowest concentration at which the subject is able to identify the presence of taste, right? So there are commercially available taste tablets, taste disc, and taste strips available, which can be used for chemical testing. Then we can also do electrical testing, which is called as electrogustatometry. This is a subjective test, and you just pass a the pass current over the tongue, right? And it stimulates the gustatory cells. And it is a metallic salt test, which is actually pursued by the patient. It cannot distinguish with different various flavors. And the disadvantage of this test is that it can actually stimulate the trigeminal nerve also, right? So this is again a subjective test, not very useful, mainly used for research purposes. There are objective tests also, like functional MRI and PET scans, and one can also get a gustatory event related potential, just like BERA, which is done for auditory pathway. We can actually do a gustatory evoked potentials for the taste pathway, but again, this is under research, and it can be a good tool for medical legal patients. So now we come to the treatment. So treatment is basically non-pharmacological and pharmacological. Non-pharmacological treatment is basically spontaneous recovery. We can ask the patient to discontinue medication which is causing taste disturbances, and there is a role of transcranial magnetic stimulation. Though it is in research, but some papers have actually described the role of transcranial magnetic stimulation. Pharmacological, there are only 2 drugs which have been studied extensively. One is the antidepressants, and second is zinc gluconate. So we'll discuss these in detail. So what are the general measures which can be given to the patient? One is the counseling and reassurance, because many of these disorders are idiopathic in nature. So they will actually recover on their own, and it is important to counsel and reassure the patient. Relatives and neighbors can actually be asked to check for spoiled food, because patient is not able to have a good taste sensation, so he can eat spoiled food and can lead to food poisoning. Smoking cessation is advised. Good oral hygiene measures, gargles, saline gargles are advised. And if the patient is having hypoglycemia, then you can actually give some salt and monosodium glutamate for flavor enhancement while eating. Non-pharmacological treatment options is spontaneous recovery. I told you that there is a high degree of spontaneous recovery, and this is the first line management. Time range for full recovery can extend up to 2 years. As we have seen in COVID-19 induced infections, many of these patients actually improved on their own. Medication discontinuation. So again, it can be several days to months until normal taste function recovers. So one of the example is terbinafine, and it causes taste disorder classically 3 to 5 weeks after starting, and it takes around 5 to 6 weeks after stopping the drug to recover the taste. Transcranial magnetic stimulation has been reported successfully in some of the papers, but it is not used routinely, and the facility is also not available everywhere. Evidence of pharmacological treatment, so, and the quality of trials. So there have been numerous trials, but all of these are very small sample size trials, uncontrolled successful treatments. People have tried ice cube suction, local anesthesia, theophylline, alpha lipoic acid, vitamin D substitution, zinc therapy, corticosteroids, and vitamin A. And many of these studies have actually not proven to be very effective for taste disorders. And there are only two groups of medication which actually have some evidence of usefulness in taste disorder, and these are called zinc and antidepressants. So zinc gluconate, this is the only drug which has been well investigated. It is useful for idiopathic taste disorder. When you have ruled out all the organic causes for taste disorders and you label the patient as idiopathic, then you can start this drug. 3 months of zinc gluconate is given orally in the dose of 140 milligram per day. And what they have found is that zinc is a crucial cofactor for salivary proteins, and it is also important for growth and turnover of taste cells. And one of the papers actually said that the zinc actually helps as an antidepressant, and it also enhances the other effects of other antidepressant drugs, right? So this is a drug which is useful in idiopathic cases but not effective in chemotherapy induced taste disorders. The other drug which has found useful is antidepressants, and it has been said that the mood of the patient and the taste complaints are interlinked, right? So a patient who is depressed will have poor taste sensation, right? Idiopathic dysgeusia might be a neglected symptom for mild depression, and people have tried amitriptyline, valproate, and gabapentin for treating taste disturbance, which is associated with mild depression. There is another term which is called as burning mouth syndrome. In the burning mouth syndrome, there is a taste disorder seen in almost 30% of the patients. And basically, patient has pain and taste disorder, and it usually responds to the neuromodulators like clonazepam. So that's all. I would like to introduce this book, which is written by me, and it covers all the topics as prescribed by the NMC, and it is based on competency-based medical education. It has got more than 1,000 clinical pictures and illustration, and it's very easy to understand. So I will request all the delegates to please recommend this book for your UG and PG students. Thank you very much. If you have any questions, I will be very happy to answer. Hello. Hello.
Thank you very much, sir.
Right.
Nimisa, are you
So,
there? Please
yeah,
switch
I'm
off the
here.
recording.
So, how much time was it? Total time which I took?
I think it is around 30 minutes.
30.
Ah,
Hope. So I took 10 minutes extra actually. Eh?
yes, sir.
Is
Miss
it okay,
Nimisa,
or
are you
you can
there?
edit the things if you want,
Sure, sir, sure.
right?
The technical
Okay.
person will help for that.
So, should I leave now?
Yes, sir, you can leave now, sir.
Right. Thank you very much.
Thanks a lot for your time, sir.
Thank you. Thank you. Thank you.